All right, so this one in pharmacology, we're going to go over renal, urinary, ophthalmic, otic, dermatologic nutraceuticals, and immunology drugs. Whew, that's a mouthful. All right, so renal and urinary type drugs, these are primarily going to be like diuretics, cholinergic agonists, anticholinergics, adrenergics, angiotensin drugs. They're going to be converting enzyme inhibitors, vasodilators, vasodilators and calcium channel blockers, antidiuretic hormones, urinary acidifiers and alkalizers, xanthine oxidase inhibitors, and urinary tract analgesics. We're going to touch base on all of them, I believe. We're not going to go way in depth into them though. So diuretics, this should be a little bit familiar from our respiratory and heart, our cardiovascular PowerPoints. So these are going to be used to remove excess and extracellular fluid by increasing urine output and sodium excretion and reducing hypertension. So this is going to help lower blood pressure. Furosemide is probably going to be our most common diuretic that we use in vet medicine, which is also known as Lasix. And so we have to supplement with potassium for long-term patients, though, unfortunately, because we are pulling all this fluid out, it's actually going to pull all that potassium out of their system as well. And to maintain homeostasis, we need to have that potassium there as well. Osmotic diuretics, so these are going to exert high osmotic pressure in renal tubules, which draws water out of kidneys to prevent reabsorption of it. So this is another way that we're going to pull fluids out of the system. Mannitol glucose is going to do that as well on its own. Thiazide diuretics, there we go. Oh, too far. Are going to reduce edema by inhibiting reabsorption of sodium, chloride, and water. Longer duration of action than a loop diuretic. We have to make sure again that we're watching for hypokalemia as well. Potassium sparing diuretics are going to be weaker but conserve potassium, which are nice. Again, a lot of these diuretics we're not using as much in general practice. We will use them sometimes in specialty medicine. Sometimes these are human diuretics that we will use occasionally in vet med. So just be aware of that. So these potassium-sparing diuretics are weaker but conserve potassium, also called aldosterone antagonists. So they antagonize aldosterone, a corticosteroid produced by the adrenal gland, increase excretion of sodium and water but reduces potassium excretion. Diazide and aldactone are examples of that. You don't necessarily need to know all these. Cholinergic agonists are going to promote function of acetylcholine. They have a parasympathomimetic effect, and so these are going to mimic the effect of the parasympathetic nervous system. They help with smooth muscle contraction and used to help urinary bladder empty. Bethanechol is used commonly, can cause cholinergic toxicity like vomiting, defecating, dyspnea, and tremors. So we use it every once in a while. Antidote is atropine, also as in an organophosphate poisoning, pesticides, herbicides, and nerve gas. Symptoms known as salivation, lacrimation, urination. So this is that SLUD that we've talked about before. Defecation, profuse sweating, GI motility, and vomiting. So we have to be really careful with this bethanechol. The antidote for bethanechol, if they get a overdose, is atropine. There we go. That makes more sense. Anticholinergic drugs are going to be opposite of cholinergic drugs that block action of acetylcholine in the parasympathetic nervous system. So these are also called parasympatholytic drugs, which produce muscle relaxation. So they are blocking these actions. They promote urine retention by reducing the urge to urinate. Propanthyline or probanthine, butylhyoscine or buscopan are going to do those. Urinary acidifiers aid in dissolving, prevent formation of struvite uroliths, which are urinary crystals. We now have acidifying diets, so these drugs are less commonly used. You don't need to know these drugs, just know that we have diets that will help with acidifying urine. Xanthine oxidase inhibitors, Xyloprim, these decrease production of uric acid and are used with prescription diets to dissolve ammonium acid urate uroliths. So these are a different type of urinary crystals. Once stones dissolved, the patient switched to an alkalizing diet with low protein. So there is drugs, but now this stuff isn't a diet. This is a short-term diet that we can use to help dissolve crystals, and then they can go back on a maintenance urinary diet after that. Urinary alkalizers manage ammonium uric acid, calcium oxalate, and crystal and cysteine uroliths. So these are going to help also prevent urinary crystals building up. We will talk a lot more about urinary crystal buildup in the 130 class, which will be next sequence for you guys. Moving on to ophthalmic and otic type drugs. So eyes and ears. So mydriatics and cycloplegics. Cycloplegics are going to act via the parasympathetic action to block muscarinin receptors of the ciliary body and paralyze ciliary muscles to inhibit accommodation. So this is going to help the eyeball from constricting. Your pupils, mydriatics are going to help also dilate that pupil as well. Miotics are going to constrict the pupil. There are sometimes some conditions we need to have the eye dilated to reduce pressure or constrict it to help kind of like bring everything in. These are drugs that can reduce intraocular pressure as well. They're usually a topical. We can see topical anesthetics, we can see ophthalmic stains, and we can also see collagen shields to help kind of protect that cornea. Other drugs over here, topical ophthalmic anti-infective. So there's antiviral drugs, antibacterial, and antifungal drugs that we can give and place into the eye. Treating Characonjunctivitis sicca. So this is canine dry eye. That we can see in some breeds, or some animals are just predisposed to it. There are topical ear anti-infectives as well. So antibiotics for ears, antiparasitics for ears, drying agents and cleaning agents as well for ears. So with our different types of meds here, you don't necessarily need to know like way in depth on these guys. We're just going to talk about some of them here, and I'll just briefly go over these guys. So for our eye medications, terramycin or oxytetracycline, there we go. It's an ointment. It's for dogs and cats with superficial ocular infections. So if they have a bacterial infection, such as conjunctivitis, keratitis, pink eye, corneal ulcers, blepharitis, bacterial inflammatory conditions that may occur secondary to other infectious diseases. You don't need to know necessarily about like who manufactured it or anything. Note that this is an ointment. Vetropolicin is the brand name. We also call this bacitracin, neomycin, polymyxin. We also call it BNP ointment. There are also drops. You have to be aware of that. A lot of our medications come in ointment or drops. So the BNP ointment is used for superficial bacterial infections of the eyelid and the conjunctiva in dogs and cats due to like organisms susceptible to this antibiotic. So we use BNP and ointment a lot. Sometimes you can see it like the one down here, the Vetropolicin HC. That means it's got hydrocortisone acetate. So this means it has a steroid. That's the biggest difference between the two medications there. You have to be very careful when your doctor asks for their eye medications. You have to make sure that you're getting either ointment or drops because that can make a difference. Ointment lasts longer on the eyeballs than drops. Drops we have to reapply multiple times a day, while ointment you only have to apply like twice a day because it slowly dissolves over the eye. So with that, that's you have to make sure you grab that for starters. And then when you're grabbing like a BNP ointment, you have to make sure you're not grabbing the one with the steroid in it. There are some eye conditions like corneal ulcers that you can't give them a steroid because it can cause even more pain and irritation in the eye and actually will prevent the eye from healing much. So just be aware of that when you're grabbing these eye medications. Make sure if they're like, oh yeah, give me the BNP ointment. Okay, which one do you want? The one with steroid, one without? Like one without steroid. So make sure you grab that one. Neopolydex. So this is neomycin, polymyxin B, dexamethasone. This also comes in ointments or drops, so make sure you're grabbing the right one. Used for inflammatory conditions of the palpebral and bulbar conjunctiva, the cornea, and anterior segment of the globe. So this kind of coats the whole thing. Yeah, so make sure if they want Neopolydex that you grab the one with the steroid in it. Gentamicin drops or gentamicin drops, these are going to be used to treat bacterial infections of the eye or the conjunctiva. We talked about gentamicin before in our antibiotics PowerPoint. Other things that we can use on the eye are fluorescein stains. You guys won't actually be performing the stains themselves, but you will be restraining for the procedure. So what this does is that it stains the precorneal tear film and tears and exposed corneal stroma. So our tear ducts go into our nasal cavity as well. So sometimes these guys will drip the stain out their nose. So this will not penetrate an intact cornea. So if there's a scratch on the eye for any reason, like say got in a fight or they got like a bush or something in their face, any little microabrasion, the stain will actually pick up like this photo down here. You can see the little white line there or the yellow line. It will glow under a black light or the ultraviolet light. So we drop the stain onto the eyeball and then we will turn the lights off, shine a light there. If the stain takes up, we can see the actual scratch there. If it doesn't take, then it'll just all get washed off. Before we actually apply the stain, we will apply a topical anesthetic, which is proparacaine hydrochloride. It's a numbing local anesthetic. This stuff is fantastic. I can speak from experience of having a corneal ulcer. It really sucks. So it's funny because they do the same thing in people that we do in dogs, and I had no idea about that before I had my ulcer. The proparacaine hydrochloride is a really, really nice numbing agent. So, and then we stain their eye, and then after that, if it's all good, then we rinse it out. Other eye drops that we can see, atropine drops. These cause pupil dilation, useful in animals with corneal ulcers. Again, those are really, really painful. These are going to help reduce inflammation and give some pain management there. It's a pretty expensive atropine drops, I believe, are. We can also give them tear substitutes. Artificial tears, Genteel, Lubrithol, eye drop vet. So if they need to have their eyes lubricated for any reason, we will give them some of this stuff. We will also use tear stimulants. So animals that have chronic dry eye, we will give them a couple different medications. These medications are unfortunately lifelong medications. Our other tear stimulants that we can use, Optimune is a cyclosporin ointment, so it's got a antifungal component to it as well. This is used to treat Keratoconjunctivitis sicca. Tacrolimus is also a similar drug as well. So we use these in canines. Unfortunately, with this drug, it is super expensive. We're talking like $40+ a tube, and these are lifelong medications, unfortunately. It is a condition that we have to treat medically, otherwise their eyes can get super, super irritated. We can see ulcers form to the point where their eyes are so irritated that we have to remove their eyeballs. So not a fun one by any means. We see this a lot with like our brachycephalic critters, like our Shih Tzus and pugs and things like that. Other ophthalmic drugs, glaucoma. So there's some drugs that we can use to reduce inflammation, excessive pressure in the eyeballs. Cosapit, Timolol, Betaxolol, duralzamide, and and brinzolamide. I've used timolol before in cats and dogs. It works really well. Odic drugs, so drugs that are going to go in the ear. Triodic, malicetic odic, Otomax, Positex, Momentamax, Suralon, Batril-odic, Milbamite, and Tresiderm. You don't need to know all of these individually. I'll point out some of the ones that are kind of important to know. Some of these guys are going to be cleaning agents. Some of these guys are going to be like antibacteria, antibiotics that go in the drug. Some of these have steroids in them. Some of them have antifungal properties, things like that. Malicetic odic is going to clean and dry the ear. This is a cleaning agent. Triodic is an antibiotic and an antifungal in it. Positex is a really big heavy hitter. It's got a bunch of antifungals, and it's also an antibiotic, and it's also an anti-inflammatory, and it's used very commonly in these animals that have chronic ear infections. It's a big heavy hitter drug, not usually the first choice when it comes to treating ear infections. Momentamax has uh, antibiotic in it, and it has antifungals in it. Suralon has a steroid in it and antifungals and also an antibiotic. We can also use it to treat skin conditions. Batril-odic is our heavy hitter antibiotic as well, and so we don't use this as usually a first choice. Milbamite is a ear mite treatment for cats and kittens, Milbamius inoximi. That's what it is. Tresiderm is a different type of antifungal, and it's got a steroid in it. This big guy, we don't use him, first out of the gate. We usually use this as a secondary. This one does need to be refrigerated. That's something interesting to note if you see it in clinic. We do use it a lot. So here are examples of all of our different medications here. Here's our ear cleaners. Here's Positex, Tresiderm, Milbamite, Triodic. I've never used Milbamite before, and I've used like other types of antibiotic ear medications. So there's a ton of them out there. Dermatologic medications are big guys. We've talked about like antibiotics and stuff before. The big guys, if we're treating skin issues internally with antifungals or antibiotics, we will also treat them topically as well. We use a lot of shampoos. That being said, you don't need to know exactly all the different brands. These are just examples of them. Your clinic might carry something completely different, or you might have used something different. A lot of these are going to have like moisturizers in them. They're going to have antibiotic properties like chlorhexidine. Some of them are also going to have like ketoconazole in it, so that's going to be an antifungal. The biggest thing with our medicated shampoos is that you can't wash them the same, wash animals the same. You're going to use about half the amount that you normally would on your pet. The biggest thing is that these don't suds up like our other soaps do, and so a lot of people are like, "Oh my gosh, I went through half the bottle in like 2 baths." They were like, "Okay." Like, it wasn't sudsing very much. Okay, well, this stuff isn't meant to suds and get that animal clean. This is meant to help break down and kill bacteria or fungal infections that are living on the skin. So with these guys, I always recommend washing them first in just a normal overall dog or cat safe shampoo, and then going back and using the medicated shampoo on there. Contact time is key with this stuff. You have to make sure that the shampoo is in contact with the skin for a period of time before you wash it off. And you don't want to use like super hot water or super cold water, and you don't want to use a forced air dryer to dry them, because heat helps bacteria growth. Atopica, this is also a skin drug. They are cyclosporin capsules. These help treat atopic dermatitis, which is an inflammatory chronic skin disease associated with allergies. So if like an animal has seasonal allergies, whether they're contact or aerosolized allergies, this is primarily what we're going to use for them. Other dermatologics, fatty acids. So these are like our omega-3s, omega-6s. They can come in a capsule or liquid. These are usually fish oils. And so these guys are really good with animals with dry and flaky skin, but also ones with allergies, autoimmune disorders, arthritis, inflammatory conditions, yeast infections, eye development problems, heart problems, some cancers, help levels of triglycerides and cholesterol. So an omega-3 and omega-6, like, you can't go wrong with giving an animal that. It's just, something extra that helps. You can give them human grade fish oils as well. You just have to get the proper dose from your doctor. These guys require a high dose comparatively to what people can actually take. So that's pretty interesting as well. Nutraceuticals. A lot of these guys we're talking about are like joint supplements. These contain glucosamine, chondroitin, and MSM. These help reduce inflammation and help reduce cartilage breakdown in dogs and cats. A lot of these guys, there's so many different joint supplements over the counter that you can buy. There are some prescription ones. Every clinic's going to sell something a little bit different. You can find them online, 10 times cheaper. Um, People take this stuff as well, the Dasaquin and the glucosamine. It doesn't hurt to put your animal on this. It's pretty much just to prevent extra layer of protection for your animal, especially if you have like a large breed dog. Should really get those large breed dogs on joint supplements sooner rather than later. I've had my large breed dog on joint supplements since he's been 2 years old, because he also like was very super athletic around then, and so I was worried about his joints. Especially like if you have a Dane or like an Irish Wolfhound, these really big, heavy guys, making sure that you're just helping their joints out in any way possible. It doesn't really affect them. Otherwise, we don't see much side effects from them. Fortiflora is a probiotic used in dogs with IBD or chronic diarrhea, or dogs in boarding facilities for stress colitis, so inflammation of the colon. A lot of stress can cause like diarrhea and things like that. So this is just a nice little probiotic to help, boost that and help kind of control soft stools or things like that. There's a lot of different types of probiotics out there we can give our pets. Um, immuno- Immunological types, vaccines, antitoxins, antiserums, and immunostimulants. We're not going to talk a lot about these because we're not going to really cover a lot of them. This, if you want to look at different types of antitoxin, you can go to the CDC and look at those. The main ones we're going to talk about are vaccines, antiserum. We're going to talk more about there we go, talk more about anti-serum if we were in a place that needed a lot of that, or antitoxins. We're talking like places that have rattlesnakes, or any other types of venomous animals poisonous animals that these animals would need to be treated for. Immunostimulants to help that immune system, um, if they have immune mediated diseases, things like that, to help kind of boost that up as well. Ooh. So our dog vaccines that we're going to talk about, we're not going to talk a ton about these just because we talk this a lot about vaccines in our 150 class, which is the husbandry class. Um, so our core vaccines are distemper, adenovirus, parainfluenza, parvovirus, and coronavirus. Actually, corona is not really a core vaccine for dogs. And I know with the corona we're talking about right now, they're like, oh my gosh, dogs, we need to vaccinate for corona. It is a completely different type of coronavirus. The coronavirus that dogs get is more of a GI type corona than what's going around right now. That's all upper respiratory. A lot of people want to argue that leptospirosis is part of a core vaccine. It's technically not. Leptospirosis is a bacterial infection that's spread through the urine of wildlife. And we usually recommend those to patients that are like hiking, camping, live on property, or in contact with possible places where wildlife has come through. Bordetella is kennel cough. Again, that is a non-core vaccine. Lyme disease, that is a non-core, that is transmitted by ticks. Rabies is a core vaccine. That is a neurological virus that is transmitted through saliva, and it results in death, unfortunately. Canine influenza is a upper respiratory condition that we can see. There are a couple different strains of that fly around every once in a while. If you're, traveling long distances, or if you're, going to high populated areas, we have to be concerned about that with our dogs. So those are non-core. That is a non-core vaccine. For our cats, their core vaccine is FVRCP, so which includes feline viral rhinotracheitis, calicivirus, and panleukopenia. That's their core vaccine. Non-core is going to be FELV, which is the feline leukemia virus. This is immuno compromising disease that cats can get, very similar, where they don't produce enough white blood cells. Rabies, just like in our dogs, it is a core vaccine. Cats can get chlamydia. It's not like people chlamydia, where it's all in the down in the groin region. Their chlamydia is in their face. It is also caused by a virus. And then the feline immunodeficiency virus, or FIV, it's like equivalent to feline AIDS, so that their immune system is kind of shot at that point. And these are transmitted through direct contact with these cats as well. Same thing with the FELV. So, right, that's it. Thank you.